Presidential nominee Hillary Clinton brought attention to pneumonia after signs of her own illness. Doctors say you're more likely to contract the lung infection after having a cold or the flu. And Dr. Angela McLean with People's Health joins us now with a look at the symptoms and how you can ensure healthy aging. Good morning. Thank you for joining us, Doc. So, elderly people are more susceptible to pneumonia, but first of all, tell us what it is, because it sounds like this scary condition when you hear it. Tell us what it is.
Well, the easy way to just think of it is it's an infection of the lung. The extremes in ages are usually more susceptible to pneumonia, so very young children, older individuals. One of the reasons why those are the largest groups where we recommend vaccinations.
All right. And so at 69 years old, it wasn't uncommon for someone that age to easily get pneumonia.
Correct. Usually if they have some underlying illnesses like asthma, COPD, if they're smokers. But you know, the fact that she was basically in good shape and healthy, she probably, you know, she responded pretty quickly to it, and it wasn't something that required hospitalization.
What are some prevention tips for folks hoping not to get, you know, a lung infection? How do you prevent that?
Well, one is, you know, try to stay nice and healthy. Definitely avoid smoking. Particularly if you're older, we definitely recommend getting your vaccinations. Flu vaccine, particularly this time of year. The new flu vaccine is available. And also there's also a pneumonia vaccine as well.
Yeah, so kids very young and also the elderly more susceptible to pneumonia. Any different kind of treatment for the kids, even maybe toddlers or people up to maybe 10, 11 years old?
Well, it just depends on, you know, there are viruses that may cause pneumonia. You can get pneumonia from the flu. There are also different types of bacterial pneumonias. And so depending on the age groups and underlying illnesses, there are different types. But in terms of some of if they're bacterial pneumonias, most of the treatments, other than how we dose it, are pretty similar.
How do you know if you have pneumonia? What are some of the symptoms?
Well, a lot of the patients will present with fever, cough. It may be dry or productive. They may also have chills, sweats. Now, very old individuals sometimes aren't even able to mount adequate fever. So their symptoms may be a little different, and they may actually just maybe present a little confused.
Lightheadedness or dizziness?
That's as well, yeah.
All right. What do you want to tell people anyway? I mean, you deal mostly with elderly health as well.
Yeah, adults, yes.
What do you want to tell people about just the general course of action if you want to stay healthy as you get older, because your immune system may be a little less fighting and strong? What do you want to tell people? Well,
really, just take good care of yourself. So a nice, well-rounded diet, lots of fruits and vegetables. Exercise is key. Try to stay at a nice, healthy weight. Sleep is essential. So we spend a lot of time talking about sleep hygiene, making sure you have that television off, the lights off, to try to get a good 7 to 8 hours of sleep each night.
All right, that's good advice. We'll try to stick to it on the morning edition, but I don't think it's going to go over too well. All right, Dr. Angela McLean with People's Health, thanks so much for joining us.
Thank you.